She integrates clinical care, research, and health innovation to advance cognitive wellness and healthy aging. Her work brings science and policy with a focus on early intervention, equity, and economic strategy in brain health. Dilpriya?
Thank you. Hi, good afternoon. My name is Dr. Dilpriya Mangat. I'm a physician, a geriatrician, and a brain health advocate. I'm here today to talk about a new kind of blueprint, one that doesn't rely on what we extract from the ground, but what we build in our mind. In Alberta, our economy has always been resource-driven. But now, the most powerful resource we have isn't oil or land, it's our brains. And the question is, how do we protect them, strengthen them, and build our future around them? Okay, Why am I here? In my work as a physician, I have treated people in all stages of life. But no matter the setting, one pattern keeps repeating. When brain health is neglected, everything else falls apart. Relationships, work, physical health, even entire family systems. Brain health isn't just a clinical issue, it's a productivity issue, it's an education issue, it's a caregiving issue, and more than anything else, it's an economic issue. That's why I'm here, because the time to act isn't 2040, it's now. Let's start with where we are. Alberta is the youngest province in Canada. Average age is 39.1 years, but also aging fast. By 2040, 1 in 4 Albertans will be 65 years old. At the same time, we have the highest dementia care costs in the country, over $83,000 per patient per year. This includes direct medical costs, long-term care costs, informal caregiving, and productivity losses tied to each individual living with the disease. By 2040, Alberta's dementia burden is projected to hit $15 billion annually. 1 in 5 Albertans already faces a mental health issue every year. Women, who shoulder most of the caregiving responsibilities, also make up 70% of Alzheimer's cases. Add in absenteeism, presenteeism, and workforce disability, the economic impact of poor health becomes undeniable. Fortunately, in Alberta, we also have an increase in venture capitalist spending in AI and health tech. So how do we respond? Through brain capital. Brain capital is the cognitive, emotional, and social capacity of Albertans. It includes how we think, how we adapt, and how we solve problems. It determines everything from how our children learn and how our workforce innovates. And the numbers are clear. Poor brain health can cut GDP by up to 4%. But every dollar invested in mental health yields up to 5 in return. That's not just good policy, that's smart economics. This is about moving from crisis response to long-term capacity building. And Alberta is ready to lead. Alberta has the building blocks. We have strengths in artificial intelligence, digital infrastructure, and public-private community corporate collaborations. We've done it before in clean tech, in energy, in health tech, and we can do it again. One major opportunity is a platform called BrainCode. Originally developed by the Ontario Brain Institute, BrainCode is a secure digital environment that integrates cognitive, clinical, imaging, and genetic data. It enables early detection, biomarker research, and longitudinal studies. Alberta can create our own version of this, leveraging Alberta Neuroscience into an Alberta BrainCode. It would support local researchers, scale digital tools, and drive partnerships across our universities, clinics, and innovators. And crucially, it would help us track and measure brain capital over time. It starts by making neuroplasticity practical. Let's launch programs that build executive function, focus, and emotional regulation, not just in rehab clinics, but in schools and workplaces. Imagine teaching a 12-year-old how to manage stress, or a frontline nurse how to recharge cognitive capacity between shifts. This isn't futuristic. It's proven science we're just not using widely enough. And in rural and Indigenous communities, we need to meet people where they are, with cognitive resilience tools that are low barrier, culturally appropriate, and co-developed with community leaders. If we do this well in Alberta, we can lead the country. Nationally, scaling brain capital strategies could add $87.9 billion to our GDP, unlock 600,000 work years, and extend healthy life expectancy for every Canadian. This is how we address aging, workforce shortages, and mental health, not in isolation, but as one integrated economic strategy. It starts with leadership, measurement, investment, and the courage to reimagine what prosperity looks like. The work I presented today is captured in our white paper, Brain Capital and Alberta's Role in Shaping the Future of Canada's Innovation Economy. It was co-authored by an incredible group of leaders, clinicians, economists, researchers, and public health experts. People who believe, as I do, that the brain economy is not just a theory, it's a foundation. And Alberta is ready to build it. So in final, I have a call to action. To the G7, to Canada, to Alberta's decision makers. Treat brain health like infrastructure. Fund early detection and screening. Invest in women's health and cognitive equity. Support caregivers. Modernize workplaces and embed brain capital in your innovation and economic planning. We have a chance to lead the world. Let's not wait for a crisis to move. Let's move first. Thank you.
All right, our next speaker is Dr. Jane Rylett. Dr. Jane Rylett is a distinguished university professor at University of Western Ontario and scientist in translational neuroscience group at Roberts Research Institute. She serves as the scientific director at the CAIHR Institute of Aging from August 2019 and is a fellow at the Canadian Academy of Health Sciences. She's also past chair of the Department of Physiology and Pharmacology, I almost said pharmacology, at University of Western Ontario. Lastly, Dr. Rylett is a cellular and molecular neurobiologist studying consequences of age-related changes in brain and neurodegenerative diseases, and she's recognized internationally for her contributions in studies of cholinergic neurobiology and Alzheimer's disease. Dr. Rylett.
Well, thank you very much. You stole the first part of my of my talk. So,
Doing what they tell me to do.
my presentation is going to launch off what you've heard before, both from the last speaker, but I'm going to the other end of the age spectrum. And so Alice actually introduced part of this during the panel when she mentioned about the older person and brain health of older persons. And so I've spent my career as a neuroscientist studying the aging brain and what can go wrong in the aging brain and lead it down a path towards neurodegenerative diseases. And so I've become absolutely passionate about what it requires for the health and the well-being of older persons as a holistic person, but in particular about their brain. Also, I'm an older person, like everybody in the room. We're all aging a day at a time, but I'm actually over 60. And for those of us over the age of 60, we already know something that society often forgets, that aging is not the end of the story. It's only part of the story. And for many, it can actually be the best chapter in the story. A century ago, the average lifespan globally was between 30 and 40 years. Today, it's globally over 70, or around 70. But in other countries like Canada, Japan, and France, the lifespan is around 85. That's more than double what it was a century ago. But when we think about aging, our social scripts on aging, what society thinks about aging, hasn't aged very well. Too often, aging is depicted as physical and cognitive decline, and we hear so much about the impact, the burden of the growing population of older persons. But there's evidence that says otherwise. So when you look at people in their 60s, their 70s, and their 80s, they're contributing now more than ever. And that's really what I want to talk about. So in the workforce, in caregiving, in civic life, they're innovators, they're leaders, they're mentors. And yes, they're still learning and growing and creating. So when we start looking at older persons globally, older persons are the fastest growing segment of the population. That's true in Canada, it's true in most countries, even some low and middle income countries. By 2050, 1 in 6 people globally will be over the age of 65. And we just heard about what's going to happen in Alberta with, I think, 1 in 4 people being over the age of 65 by 2040 perhaps. But several countries around the world are either now or will be shortly super-aged countries. In that case, over 20% of the population is over the age of 65. Over 1 in 5, often 1 in 4 individuals being over the age of 65. That includes 5 of the G7 nations: Japan, Canada's on that list, Germany, Italy, and France. And the United States and the United Kingdom are not very far behind. That's a lot of brain capital. So let's talk now about brain capital and the older individual. So it has been considered by some that this burgeoning, growing older population is going to be a burden, that it's a crisis. But let's think about it as an opportunity. It's a powerful opportunity. So that's if we choose to see it that way. So in Canada alone, persons over the age of 65 contribute over $60 billion annually through unpaid work, through volunteering, caregiving, mentoring. That's more than some of sectors that contribute to our economy. Aging brain is an invaluable resource, not only for the individual quality of life, but also to countries and economies to which they contribute. Understanding how to protect brains throughout life and in aging, and how to reduce the risk associated with age-related neurodegenerative diseases is more important now than ever. And I'm going to come to a call for action just in a few minutes. So for years, aging societies have been considered a looming threat. Forecasts predicted shrinking labor markets and economic decline, but that's not what's happening. In fact, employment rates for older persons are rising. Older people today are more capable, more engaged, and more productive than ever before. So, some numbers from Canada. In 1994, about 6.6% of the Canadian workforce were over the age of 65. By 2023, that number had more than doubled to 15%. Why might this be happening? A number of factors come into play. Later retirement ages, for example, increasing education levels, which allow for retraining and new production. And for some, there's a need to continue working, but there's a desire to continue working. Just as importantly, improvements in cognitive health that have come about in recent years with new prevention strategies to improve brain health as we age have made it possible for older persons to remain active in the workforce that increasingly values knowledge over physical labor. This shift not only enables people to stay in paid employment longer, but importantly, not everybody wants to stay in paid employment, well beyond when they'd like to retire, but it's important to consider that supporting ongoing contributions in the unpaid workforce is absolutely critical. So things like volunteering, caregiving, mentorship are absolutely essential to society. We're only beginning to grasp the economic value of older persons continuing to be engaged. For example, in Canada, we now recognize the value of unpaid volunteers and caregivers, 1.5 million of whom are 65 and older. The Canadian healthcare system could not function without these individuals doing unpaid work. Looking ahead, it's critical to deepen our understanding of how to promote brain health and resilience in aging. We've heard a little bit about that so far, but this will help ensure older people remain active contributors in society, in workplaces, and the economy well beyond their later years. So here's my call to action. Healthy brains don't just begin in old age. They're built over a lifetime. The life cycle approach, the life course approach, whatever you want to call it, is a critical element of all aspects of health, and that is enormously true, and maybe especially true for brain health. How we live, where we live, the opportunities that are granted to us at every stage of our life will shape how we age. That is why it's essential to promote and adopt strategies for brain health across the lifespan to ensure that we maintain cognitive health well into our later years. This requires, and this is my call to action, this requires national commitments from G7 countries towards policies that support education, physical activity, social connectedness, nutrition, and continued investment in research and innovation to support ongoing discoveries. We must recognize that the powerful brain economy will only strengthen in our societies if we value the contributions of older persons. The experience, knowledge, and perspectives of older persons are assets that we can no longer afford to overlook. We must work to remove the barriers that keep older persons from participating fully. Ageism remains one of the most accepted forms of discrimination. Many people aged 55, only 55 and older, face challenges in both keeping and finding work. They're often passed over for promotions and training. It's time to reimagine aging, not as something to fear, but as a life phase of potential and purpose. Aging populations are not a burden. They are a call to rethink how we engage a vital and growing segment of our communities, and to harness the power and brains of older persons towards a stronger brain economy. Thank you.
Okay, for our last TED Talk speaker of this part, I'm very pleased to introduce you to Dr. Alexander Caudarella. He's the CEO, Canadian Centre on Substance Use and Addiction. Previously, Alexander served as the medical director on substance use services at St. Michael's Hospital in Toronto and the lead SUS physician with Intercity Health Associates. He's served as a substance use consultant and clinician for the government of Nunavut, and for more than a decade has worked on Indigenous-led programs in Canada and abroad aimed at building capacity, decreasing stigma, and building local workforces. Alexander is proud also to work with an amazing team at the Canadian Centre on Substance Use and Addiction to build hope by empowering people in Canada and government to focus on substance use issues, centering on the voices of the people who use substances and their families, and building Canada as an international leader in this area. Welcome, Alexander.
Okay, thank you for having me. Oh, gotta press the right button. Okay. You're going to hear me talk. I think a lot of things have a lot of relevance to as we continue a really meaningful journey towards reconciliation with our First Nations, Inuit, and Métis people. And you're going to hear me talk a little bit in a couple of minutes about our need to regain community and regain culture. And I think this is true across the board, but we need to remember what's been taken away from people as well. So we've heard a lot about the harms and the costs, and unfortunately, substance use is really no exception. The amount of drugs and alcohol people are consuming in our society is going up. And that big outlier at the top is alcohol. We often forget how much this is affecting our society. I think sometimes we really get stuck when we talk about brain economy, when we talk about brain health, in people who have really severe substance use disorders. And the reality is that for a lot of people at various points in the spectrum, their lives, their families, their work are affected by alcohol and drugs. It's causing anxiety, it's causing sleeplessness, it's causing all these different issues. And so I think what I'm going to keep coming back to is this need for us to zoom out. There's the loss of productivity, and I think we've heard that if we want to be a building economy, we need to invest more meaningfully in brain health and our brain economy. But there's also how it impacts the rest of our healthcare system. And I can tell you that the number of times the patients we're talking about today who need a geriatric bed, who need a bed for a hip replacement, who need all these different things, are stuck in emergency departments across this country because a person who injects drugs has, a need to be in that bed and obviously receive good medical care. But we're talking about, and if you're talking about a bloodborne infection for someone who injects drugs, you're talking about 6 weeks in an acute medical care bed. And we don't always see that these things that are highly preventable and highly avoidable, how much they're impacting the service delivery outside of this one and traditional sector. We did a survey of 4,000 people, and 67% had never been asked about their substance use. And almost 80% had never received any direct support for their substance use. It's why we're so excited to be here and why we're so glad to look at this as part of a whole of health response. What we need is everyone who's part of the healthcare sector to recognize, hopefully, that they can have a role to play in these pieces. We need really wide open doors for treatment and for access to care, but it's much, much more than that. And this is why I'm so glad so much of it is talking about workplaces. And we think about a few traditional industries, right? These ones are more affected. Yes, it's true. We've seen men in the trades be overrepresented amongst the people who are dying of opioid overdose. But when we looked at it, we actually found that this was the case across all sectors. 13% of workers in non-safety sensitive and 20% in safety sensitive workplaces were reporting consuming alcohol or other drugs or were high or hungover at work. This is the scary part. Because the people that are supposed to help them, the people above them, have even higher rates. So how are we going to help each other? How are we going to help each other be even more effective as a society when we feel comfortable? And here's one of the respondents said, too many companies ignore the problem of employees on drugs, as if you can ignore it, it will go away. There are a lot of things workplaces can do, and I'm so glad that there are representatives of the business industry, because when we did a survey, when we looked through, we could find less than 5% of workplaces had publicly available policies around substance use and substance use disorders. So if we're waiting for people to completely fall apart before we do something, we're missing all these opportunities to have healthier people and healthier society. But I think it's even broader than this. We can't blame business, we can't blame healthcare. We need a whole of society response. This is why I really enjoyed when Harris was talking this morning about how we want everyone to see themselves as part of the solution. And I think when it comes to brain health and the brain economy, that's absolutely critical. It's really scary, I get it. So this little thing on the left there, that's actually called Mount Thor. It's in Nunavut. It is the world's largest vertical drop. You wouldn't think it's in Nunavut, but it's there. And I used to sit at the bottom of it, and it's terrifying to look up at, and you can think it's never climbable, it's unsurmountable. And I think that's how a lot of us feel, because it's like you can barely get anybody to care about anything other than themselves right now. How are we going to build this whole of society response? But we've done it before. Part of the reason that every time there's a little break, 25, 30% of people aren't running out onto the balcony, we tackled and made tobacco a society issue. We didn't make it a mental health and addictions issue. We didn't even make it a health issue. We made it a society issue. We wanted to change our relationship with tobacco. And so there's this huge potential over what we can do and how we can achieve it and how we can look at it as this whole of society issue. But in order to do that, we need to help people understand that they have a role to play. Some of what's happening in Alberta is really, really great. Some of the things, for example, around the brain story. Some of the things I've been learning about that are happening in PEI, for example, around trying to zoom out and look not only at the problem, but what does it look like to invest meaningfully in what happens before somebody has a problem, in those prevention things, and having that language around it. What happens also afterwards? If we're successful in what we're doing now, all these individuals who have substance use disorders, they will get better. What's going to happen to them? How do we help them become part of society? And so what we need to be talking about is recovery informed systems, that every system, every environment somebody interacts with needs to be set up to help them. And what's amazing is if you build systems that help keep people in recovery, if you help build systems that prevent substance use disorders, those are the same systems that help people thrive and become productive members of society. When we're talking about building a skilled labor force, when we're talking about these things, this is how we get there. So this is our act. And I think we lost our way along the way a little bit, but in it says, we are supposed to increase the participation of Canadians. We've medicalized our field, which is very, very good. We've made it better, but we also need to recognize that people need to see themselves in it, and this is part of it. So this is one of the messages, everything is local. We sometimes forget this piece. We want to live in different environments, and we forget the fact that everybody in a different environment is dealing with a slightly different problem. This is the geographic center of Canada, by the way. Ask me afterwards where it is. You won't believe it. We've gone into small cities, and this is what's amazing. We found mayors from across the country, right? Here they are talking about how bad things have gone there. Most of these mayors, they make less than $30,000 a year doing their work. They are so committed to being part of the solution. It did not take anything at all to activate them. A state of despair is not a natural human state. People want to do things, people want to move things forward. And so going into small cities and instead of saying, hey, we're the experts, we're here to help, what can we do to help? What do you want to see in your community has produced these amazing results. My last thing is I just want to flip something. There's a traditional phrase around globalization that says you have to think globally and act locally. I want us to flip it. I want us doing more of these kinds of things where we're coming together from different spots around the world, but we're rooted in where we come from and the things that we hear and the things that we learn. I hope you reach out to us, and I hope you come to our conference in Nova Scotia in the fall. And I hope you all want to be part of this whole of society response to reduce the substance use harms in this country. Thank you very much.